The overall health and well-being of people living in Salford is improving. A child born in the year 2000 is likely to live 9.5 years longer than a child born when the NHS was set up in 1948. In Salford, this improvement is at a slower rate than many areas in England. There continue to be wide variations in the health and well-being of people within the city. Life expectancy varies by as much as 6 to 7 years depending on where people live. The difference in years of life without a disability is 17 years. Making every contact count, or MEC, is one of the building blocks that services and organisations across the city need to put in place to maintain the improvements in health and well-being of Salford citizens. It's about using your knowledge and skills to help people take those first steps towards making things better. MEC is about bringing together organisations that work with the people of Salford and making a concerted effort to improve lives. It's about picking up on signals that can be a starting point for people to change an aspect of their lives.
I enjoy working with people. I find the job very rewarding.
I like the customer contact.
I enjoy because of the interaction with the patients.
If you tell me what the problem is, I'll try and help.
Low-level interventions can make a big difference. Every member of staff who comes into contact with the public has the potential to initiate that change by noticing an odd comment, taking an interest beyond their normal role, and guiding someone towards help. If staff across different agencies in Salford all play a part, the accumulative effect can bring about real improvement in health.
I received a referral for a gentleman called Mr. Taylor, who was a 70-year-old that had just been newly diagnosed with lung cancer. I went out and visited him. On our initial assessment, he disclosed to me that he was quite concerned about his benefits. I advised him that I'd be able to find him a contact number for Welfare Rights Team so that he could ring them and they'd be able to come out and look at his benefits to see if he was getting the correct amount of money. Contacting him a few weeks later, he told me that the Welfare Rights Team had been out and visited him and his benefits are now been increased, so he's living much more happier and able to, make ends meet with his money.
Behind MEC is a well-defined set of principles based on thorough research, looking at how people make changes in their lives, the stages they have to go through to alter the way they think or act, and the points where others can help them on that journey.
Just to have the confidence to be able to talk to people and find out what their issues are.
Most of it is what we're already doing, so it's just looking at expanding on that, I suppose.
MEC recognises that staff in different roles will have different opportunities for interaction with the public. For some, conversations may only last a few minutes, but this can still be useful, while others can take a bit longer and have a more in-depth discussion.
It's about engaging with, we call clients, patients, customers, they're people.
Salford's approach to ensure that everyone has the skills and confidence to deliver MEC is to offer an online assessment, followed by training if appropriate. Training and support are a core part of the programme, making sure that every frontline member of staff understands the principles behind MEC and has the confidence to play their part. The aim is to create a new dimension to the help and support offered to the people of Salford, which reaches across agencies and sectors.
Sam had been coming down to access the hardship fund. He started to come down more and more and was borrowing monies that he wasn't quite able to pay back. I noticed his appearance had become dishevelled and he wasn't himself. I found out that he'd been thrown out of his family home. So by chatting to him and showing him exactly what was out there, we gave him the confidence to go and access the information for himself. Anyway, I put him in touch with Salford Opportunities, who help 16 to 18 homeless young people, and he was found accommodation in a hostel. At one point we thought Sam might have to drop out of his course because of his circumstances, but owing to all the help he was able to access, he completed his course and now he's gone on to university.
The MEC training will equip staff with skills that are increasingly recognised and valued throughout the public and voluntary sectors. And while they certainly look good on a CV or application form, more importantly, they'll improve the service that staff can give the public right now.
That brief encounter that you have, you know, it doesn't need to be a 30 minutes counselling, but just a quick chat It's about listening and communicating effectively with people and getting them to open up to you and engaging in conversations.
Making every visit count. Making every conversation count. Making every contact count in Salford.